If people knew better, they would do better. So people come up with great ideas, but they're like, Phylicia, we need a policy. And I'm like, wait a minute.
Phylicia Porter, talking about wellness, community, and what support really looks like at the city level.
Yeah.
So my first question is, where do policy and personal wellness really meet in Baltimore communities?
So it's so funny that you mentioned that, because I'm having conversations with community members, and the foundation level of policy is just not really an uptick in our communities. And I have been telling people, policy meets community, and even in the idea generation. So as the ideas are being generated in community, that is when you should be contacting your local elected official, because when we're developing policy, we're often reliant on those community partnerships, those community connections to draft the bill, to make sure that it's in effect with community, but also to truly make sure that it's impactful for community members.
So for someone who has an idea, can you walk me through? I'm totally blind. I have no concept of really how to get to a policy.
Yeah.
Can you walk me through, how should I do this?
Sure. And it's funny, I just want to shout out my podcast, I've Got Time,
Okay.
with Phylicia Porter.
All right.
Because, I got time. Because we go through that topic. We go through that topic of how an idea becomes policy. It doesn't become policy through social media posts. It doesn't become policy through simply concepts at community meeting. For you to develop a policy, I often remind people the legislative process starts at the idea generation. Then you have it introduced at the city council level. So that is the first step of the policy. Anytime before that, it is not considered policy until it hits that first reader with the city council. Then you have second and third reader, and then for final vote with the mayor's signature or the mayor's support. So all through those steps.
Wait a minute. Remember that? What's a reader?
Yeah. So when you introduce a bill at the city council, it's called a reader. So the council is talking about the bill. It's when it's first introduced. So they read the actual bill synopsis on the council floor.
Got it.
And so that's the levels where we talk about first reader, second reader, and third reader.
So it has to go through three processes.
Three levels of the process
Okay.
in order for it to become policy. And I've been telling people that at each level, whether you're engaging in support or opposition, that is an opportunity to make your voice heard. And so the council member is supposed to share kind of the engagement strategy, how to engage with the process, providing testimony. When people come to City Hall and say they like or don't like something, when people see that on the news, that is more than likely committee hearings or the full city council meetings.
Got it.
So every level, there are 4 different steps and 4 different levels where people should be engaged in that legislative process before that idea becomes policy.
So in terms of, are there any ideas that you guys just say, that's not something that needs to come to the table?
Yes. Yeah. And so we talked about, like, folks believe that, and I share with folks, a great idea is a great idea, but if it does not build the people around it and the critical number of 8 members of the city council to support it, which is 51% of the membership body, it does not become law. And so there are a lot of great ideas that do not become law because 8 members did not support it. And I use that example because many people just think you can come up with an idea and it becomes policy. We have got to get into a space where we're organizing folks, making sure folks know about the process, making sure folks know about their local representative, because if 8 members do not vote, then the policy, won't be enacted. Now, I say
It has to be unanimous?
No, 8. So 8 out of the 15 members. So the majority, 51%.
Gotcha.
And so I often remind people that when you are engaging in policy discussions, making sure you're reaching across these councilmatic districts into other city council member districts so that the people in those communities can share with their city council person. It's no reason for, it's not really good for you to talk to one person. You need to talk to 8 people on the city council in order to get it across.
So when it comes to the table, everyone's already aware.
Very much so.
And they've already made
Very much
some
so.
kind of assessment.
Yes. And then also when you're going through the process, we have to make sure that we are working within our level of government. So there are 3 levels of government: the local, state, and federal.
Mm-hmm.
Sometimes the state level and the federal level constrain, meaning that they constrain the policy conversation at the local level. And so people are like, Phylicia, why can't we do this? Because it's a law at the state level that prohibits us from doing something. That great idea, it may be prohibited at the state and or federal level. And so then the advocacy shifts from local government to state and federal government to get something across. You will want to change that state level government policy in order to affect that great idea at the local level.
That's a great point you make, because people probably never even think about that.
Oh, yeah.
You know what I mean?
Yeah.
There are other laws.
We have to make sure the laws are all in alignment.
Got it. That makes total sense. I guess my next question is, in terms of policy, is it always needed?
It's funny. I just had that conversation this week as well, because, again, people come up with great ideas, but they're like, Phylicia, we need a policy. I'm like, wait a minute. That's where, the research and the oversight comes in, because we may have laws that are actually on the books that are just not being enforced correctly or properly, I should say. And also a simple tweak of an existing law could do exactly what you want. So some of our laws may not be hitting the mark. And when we're seeing issues or concerns in community, there may be a edit to the already existing law where we can make sure that it impacts the entire community as opposed to just a few. And to answer your question formally, no, not everything needs to be legislated. That's your role as a legislator, to make sure that we are using agency guidance versus like actual laws that need to be changed and or enacted.
Is it simpler to tweak a law versus... Okay.
Yeah, not necessarily. And so I'll give you an example. When we're talking about smoke shops in the city of Baltimore, it was through research from my office where we found out that retail packaged goods establishments, that is the official zoning classification of smoke shops in the city of Baltimore. Now, grocery stores are also, under that particular zoning classification. So if we change the whole definition, we could have an indirect consequences on the exact grocery store definition versus the smoke shop definition. And so at that particular point, we are having conversations. How can we distinguish between a smoke shop and a grocery store so that it does not over complicate the zoning code?
Gotcha.
And so a simple edit may not always be the case, but I often liken it when I teach policy courses. I often say that you cannot put a square in a round peg hole, but also you have to understand you can't use a butter knife when you really need to use a steak knife. That's the really defining factor. You need to use a steak knife, but you're using a butter knife. Same category, but different modes of how you're doing the utensil.
So in terms of the steak knife, butter knife concept, can you give me a difference between what is a butter knife and what's a steak knife?
Yeah, so a butter knife versus a steak knife. Well, let's go with the smoke shop example. Okay. So the smoke shop example, if we are changing the full definition, which would change the definition of a grocery store, that would be something that is broad stroking, wide. That's more of a steak knife. So when you cut into a steak, you're going to cut into everything. You're going to cut into everything. The distinguishing factor, if we want to change the types of food in the retail packaged goods establishment versus like for the fresh foods for the grocery store. So we want to keep that intact, but we also look at the chips, the Takis, the fruit drinks that are sold in most corner stores, which are considered retail established goods. We can parse out the types of foods that could be sold, and so it's more like a butter knife. You're spreading it across all of the zoning classification as opposed to just like essentially cutting it off.
Received.
Yeah.
Received.
It's a game. It's a game. And that's why I often tell people, running for office is not just pretty pictures. You have to know the law. You have to know how to maneuver in these types of situations to get the biggest impact for your communities.
So speaking of running for office, why do you do this?
Yeah, I know. It's funny because I do it because I love it. I'm born and raised here, but there are so many laws that are on the books in Baltimore that if we just had that butter knife, steak knife comparison, we would see real change in our communities. And I've been doing this work for about 20 years now. I've been in public health for about 20 years, worked at various levels of government. So I'm bringing all of that national level approach back here to Baltimore. And I realize that if I can change Arkansas, Louisiana, which I have done through the Affordable Care Act, we can change Baltimore. We are not that far gone.
I received.
Yeah, we are not that far gone. We just have to have very substantive and impactful conversations in order for us to make true policy, transformative and change.
All right, so let's transition a little bit. What brings you here to Be Well Baltimore?
Yes, so I am here. I'm super grateful to be here today to talk about the black butterfly. Yes. Dr. Lawrence Brown was a former professor of mine, and my whole concept for developing healthy communities is essentially what we're talking about today, how health disparities within the black butterfly can not only impact you as a person, but can impact your communities now and later. And so I'm super grateful to have this wellness conversation, because most people think that health is just going to the doctors on a routine basis. No, health and wellness is feeling good in your body, eating fresh fruits and vegetables, having great mental, financial, and spiritual health, and how you feel every single day, not just when you go to the doctor.
And definitely having access to that health.
Very much so. Very much so.
Oftentimes, in the underserved communities, we don't have access to the proper food.
Yeah.
And that's why we have an uptick of the health and wellness issues.
That's correct.
I received that.
That's
100%.
correct.
So, in being well, you're aware of what Mr. Watkins is doing as the I-360.
Yes. Love it.
How is that a game changer in your mind to our communities,
Yeah.
to people who look like us?
Most definitely. So I had a chance to view a demo 2 weeks ago, and the first thing that came to my mind was transformative change that builds upon what we already do in community. So the fact that you are doing full level body scans via biometric measures that you already have through your cell phone, your Apple Watch, and linking that to hopefully, and I know he's working on this, your electronic health record, so that your physician can see it, your nurse practitioner can see it. But also, this is where I really loved the community part, connecting it to community-based resources. Like, I developed an app for University of Maryland about 10 years ago, and that conversation was still the mode then. Connecting the healthcare delivery system to public health resources, and he has cracked the code. What he has developed has cracked the code on that. And also, it allows for individuals to engage within their health. So like, you can, I know everyone loves ChatGPT, but he has provided a bot, a chat option within his server where you can tell them, hey, I'm working out today. How is this going to impact my health impact score? How is this going to make me healthy? Like, people can not only see their health changing in real time, but they can also see how different environmental factors like food, different environmental factors like exercise can impact and bolster their health score.
I think it's amazing.
Yeah.
So I agree with you 100%. I guess my last question, can we do in communities besides telling people just to do better?
I have never been a proponent of telling people just to do better. If people knew better, they would do better. So for me, again, working in public health for 20 years, education is the main issue that we have to keep pushing within our communities. But we also have to change the policies. Going back to the health disparities of food that currently exist within community, that's a zoning issue. That's a policy issue.
Yes.
That's a systems issue that we have so many bright, brilliant leaders in Baltimore are trying to change. But what I tell people, it all has to change within alignment. Community is often the remnant or the victim of when we are out of alignment in communities. So when we talk about a bunch of corner stores being in community that don't have fresh food, don't have a lot of packaged goods, we don't have affordable housing, we don't have economic mobility, those are all the issues that within alignment, if we can get everybody on the same sheet of music, we will be able to move forward. And so just telling someone to do better or be healthy, it's not really an accurate statement. We need to utilize community voice in a civic mode, in a health mode, in a financial mode to change the system to make sure things get better in community.
And how far is Baltimore from that move?
I know. In some areas, we are far away. In some areas, we have not made the change that I want to see. In other areas, we have. And I'll trace an example. When we're looking at the lifespan difference between Govans over in off that York Road corridor versus my communities in Cherry Hill and in Lakeland, we are seeing 5 to 10 to 20 years sometimes life expectancy differences. And so
Really?
Oh yeah. Wow. And so even like it was this one research article that I was reading. Even within a matter of blocks, you can see that disparity in life expectancy. And so I would say some communities have made it, but oftentimes, more often than not, Black communities have not made it. We are still consistently seeing the same health challenges that we've seen in the 90s. There have been some increase and some success, but it has not been on the level where we have 4 major public health institutions here in the city of Baltimore where we need to be. It has not, we have not seen it. We've not.
Isn't that quite a contradiction?
Oh yeah, most definitely.
Excuse me.
Yeah, most definitely. And it's nobody's fault. Like, I'm not placing blame. It's nobody's fault. But I do believe that we are out of alignment. We're out of alignment with our institutions and our policymakers. We're out of alignment with community-based organizations and actually what's happening in community. We're out of alignment with local, state, and federal level resources that permeate in community and truly attacking the root cause of a lot of these problems, not just putting a Band-Aid. And I'll give you an example. Okay. When we talk about, we'll go back to food, when we talk about knowing that we need fresh fruits and vegetables in community, that's been a staple totally forever, right? No one talks about the price. No one talks about the quality of those fresh fruits and vegetables in community. And so that just saying nutritious food in community does not tell me anything. You need to get more granular to say what types of food, what are we selling it at, how are we making it more affordable or as affordable with the packaged goods that we are seeing in community, and how are we as policymakers making sure that supermarkets provide that at cost to community.
At cost is the key word. Because
yes.
Even to eat organic.
Yes.
It's and I love Whole Foods, but it's definitely a whole check.
Very much so. You'll spend a whole check. But if you go to Walmart or you go to some of the other retailers, you'll see the same quality of food at a much higher rate. And I don't want to use Walmart because Walmart has a very unique pricing model that I don't think people, but I'll use Whole Foods versus same quality versus like an Aldi.
Yeah. I received that.
Yeah. Same kind of, and similar similar kind of functionality, but you can tell there's a different quality of food within each of those markets and where they place them based on socioeconomic status.
Doesn't our aunties source their food from local?
They should.
But they don't. Okay.
I don't know if they don't, but they should.
Okay.
Yeah, I can neither confirm nor deny, but they should.
Okay. Because that would make more sense.
That would make more sense. But then also from the business side, whether our local suppliers are creating a critical mass for the grocery store. That's often when people talk about the community gardens, and the local models, the issue that exists within that scaling up often has to do with a critical mass of food needed for that grocery store, because there is a set requirement, a regulatory requirement of how much food they have to put into that grocery store.
Yeah.
Yeah.
And most people don't think about
No. Yeah. And you can get creative and form a collaborative, but how many communities are saying that they want a grocery store? We would have to have a crazy uptick of community garden and production of food in the city of Baltimore if that happens.
Yeah.
You would have to have a crazy amount.
You would have to have a farm.
Yes, more like 10 farms.
Right.
More like 10 farms in a landlocked city of Baltimore. And we do have great farms, but they need land.
Yeah.
So it gets real. I mean, that's what I'm saying. Like, I come at this really from like not a conversation of like, all right, it's this person that needs to do it. It's the system, because everything is connected to each other. The system has to be better and in alignment in order to make these changes happen.
Yeah. And a lot of us don't even want to take the time to build a system. We just want
That part.
Or don't even know that we need a system.
That part, that we don't need a system. And then, like, even from a legislative perspective, I often force systems. Like, you're going to talk to everybody. Like, you're just not going to be in a space where you are doing something and you're not talking to other systems that attack that issue. That's not a good use of our time anymore, and it's not a good use of our resources for Baltimore. It's not.
I wonder why people are so against that. Because everyone's point of view gives you a better perspective to serve all versus trying to just, because you got a plan, your plan is the plan.
But to their defense, when you look at grant dollars that are so specific in nature, that are not more broad stroking in process and also in application, then you begin to see that siloed nature of grants, of capital dollars, of operating dollars, because it's so particular and so focused. But the key is you still got to talk. You're not going to solve these issues in one fell swoop. You're not. I've managed a few programs. You're not going to do it. And if you're going to do it, it's going to be very expensive.
Wow. Well, I want to thank you, Councilwoman Porter, for being here, because they need your expertise on another panel at this point.
Yes.
Okay. So I appreciate you taking the time, because I can sit here and chat with you all day.
I would look, invite me back. Please invite me back.
Absolutely.
I enjoy talking about this. Again, I even in my role of taking it a step further, develop the video podcast so that people can really understand what government is and the myths surrounding government, but also the misinformation that some communities have been like pushing for a long time.
A long time.
Yeah.
I see that.
So,
And thanks for doing the work.
of course, thank you. Appreciate you.
Thank you.